This conference will now be recorded.
ಹೇಳ್ರಿ ಹೇಳ್ರಿ tell me. Hello, ಹೇಳ್ರಿ
Hello, sir.
ಹೇಳ್ರಿ
Sir, 2 minutes start ಮಾಡೋಣ sir.
ಅಪ್ಪಿ
ಹಾ sir. Start ಮಾಡೋಣ. Good afternoon, everyone. To begin with the quote, cancer is so limited, cancer cannot cripple love, cancer cannot shatter the hope, cannot corrupt the faith, cannot destroy the peace, cannot kill the friendship, cannot suppress memories, cannot silence the courage, cannot invade the soul, cannot steal the eternal life, cannot conquer the spirit. And yes, there is a can in the cancer and we can beat it. With this motivating thought, let's begin the session of E-Series of 2022. I, Dr. Anita Dalwai, welcome you all on behalf of DB80's SBG Ayurvedic Medical College and Hospital, the founder and president of institution, Shri S.B. Ghadke Sir, ex-MLA of Kursi constituency, chairman of institute, Mr. Amit Ghadke Sir, managing director, Dr. Mansi Ghadke Ma'am. I'm glad to extend a warm welcome to our honorable guest speaker, Dr. Santosh Patil Sir, assistant professor, Department of Agadatantra at KAHER's BMK Ayurveda Mahavidyalaya and Research Center, Belagavi. President of today's function, Dr. Shri Shetty Sir, Vice Principal and Organizing Secretary of today's function, Dr. Advesh Arkeri Sir, HOD and Reader, Department of Kaya Chikitsa, Academic in charge, Dr. Arun Avinar Sir, Coordinator of today's e-guest lecture, Dr. Ashwath Sir, Assistant Professor, Department of Panchakarma. Thank you all for gracing us with your presence. World Cancer Day is celebrated every year on Feb 4th. It is globally uniting initiative led by Union for International Cancer Control. Cancer is the second leading cause of death globally. Recent studies estimate about one out of 6 people worldwide die from cancer, which is more than HIV or tuberculosis and malaria combined. Hence, to raise awareness of cancer and encourage its prevention, World Cancer Day is observed annually on February 4th as an international event. To enlighten us in detail, I would like to welcome today's guest speaker, my senior, Dr. Santosh Patil Sir. Sir, Dr. Santosh Patil Sir was born on 19 November 1985. Sir has completed his BMS from BMK Ayurveda Mahavidyalaya in the year 2009. Sir completed his MD from KAHER's BMK Ayurveda Mahavidyalaya in 2013, and Sir is pursuing his PhD from KAHER's BMK Ayurveda Mahavidyalaya, Belagavi. Sir has a working experience. Sir has worked as a coordinator in Ayurveda Oncology Fellowship course. Sir has worked as a lecturer in BVS Ayurveda Mahavidyalaya, Bagalkot. Sir has research experience as member for research team of Central Research Laboratory, member of Scientist of Institutional Animal Ethics Committee. Sir is coordinator of CME of cancer organized by Rasai Cancer Clinic on 6th April 2016. Sir has also availed KAHER University grant for 4 projects, namely evaluation of effect of Dushishari Agada in carbolaptin-induced myelosuppression and in vivo experiment sanctioned in the year 2019. In vitro anti-cancer and biocompatibility assay of Kshar Agada in 5 different cancer cell lines by Dr. Vishalakshi Shapurkar, a final year PG scholar. Sir has been awarded as the best presenter at Jeevaniyam National Conference on Integrated Approach to Cancer Management, organized by All India Institute of Ayurveda, New Delhi. Sir has also awarded best paper at Samprahasha National Level Seminar in Vajikarana in 2016. Sir is awarded as the best speaker at the teacher debate competition at today's Media Boon or Bain at KAHER University in August 2016. Sir has more than 7 publications to his list and more than 22 presentations at different fields. And Sir has attended more than 10 conferences. To add to social activities, Sir is conducting cancer camps regularly, has delivered a series of radio talks on cancer introduction and awareness about different cancers, delivered a series of radio talks on cancer introduction about different cancers at Hubballi, delivered 3 interviews on Ayush TV on cancer and Ayurveda. Sir has delivered guest lecture on food safety at NSS Camp Allikatti, Belgaum, organized by NSS unit of KAHER Shri BMK Ayurveda Mahavidyalaya. Sir is presently working as assistant professor at Department of Agadatantra at KAHER Shri BMK Ayurveda Mahavidyalaya, PG Research Center, Belagavi. I welcome you, sir.
Thank you, Dr. Anita, for kind introduction.
Yes.
Yes.
Hello, Dr. Anita. Should I start?
So you can start, sir.
Hello?
Hello, sir. You can start,
Yeah,
sir.
thank you so much. Yeah. Right. Very good morning to one and all. So, you know that the incidence of cancer is increasing every year. And above all, the patients who survive the cancer are also facing so much of difficulty that the condition lands up in so pathetic. And this year theme based on that, so they have given that the close the care gap, the World Cancer Day on Feb 4th, which is celebrated. So this year's theme that has been put forth is close the care gap. It means there is an inequity that is prevailing regarding the care that needs to be given to the cancer patients. So where exactly do we Ayurvedic people can stand up or fight for the cancer is one of the major question or the area where we have to work upon. So let's see today, like, why actually we need to understand cancer, in which way we need to understand it, and is there any role of us, and how much role do we have. So I'm just going through the basics for you all to understand, like, there is a strong role that Ayurveda can do play for the cancer patients. Okay. And at the outset, I would like to thank the entire committee of the SPG Ayurved College for providing me the platform to share my experiences, which I have done in the cancer. So I thank everyone at this outset, and then we'll see the presentation. The cancer. So we need first. See, I at the initial out practice when I was not successful, or what you can call sudden. But what would even the patient do even if the proper guidance is not given? That needs to be understood. See, there was a female. Why we need to know cancer is because a female of 46 years, she had a small lump in her breast since 6 months, and it was associated with pain occasionally. But there was no discharge or any skin changes. And after getting investigated, it was known that it was kind of a fibroadenoma, and so she neglected it. And what happened actually, she consulted us Ayurvedic people, and then we said, okay, this can be done to a certain extent, but there's definitely a surgical aspect that you need to take care, and then done. But the patient was very adamant and so was not able to take it. So what happened? Even we were not able to force her to get it done, and then yielded to her. Yielded to her means that she asked for Ayurvedic medications, and we started it. So what happened after 6 months is that this lady landed up in having full blown CA breast and then having lung metastasis. So a lady who could have been operated on a day where she has consulted us could have led a normal life at least for 5 to 6 years later, in case if there was no recurrence. But she neglected it, and sometimes patient asking medications from Ayurveda and we do give them. And because of that, what happens sometimes without knowing the gravity of this disease cancer, she landed up in having lung metastasis. That means the cancer spread even to the lung, and then she collapsed within 3 to 4 months. So these are the conditions. Similarly, another case, a male somewhere around 60 years had a nodule in a tongue, and he was under flow medications. Okay, and then after visit we told that okay, please get a surgery done, but he was not yielding to our decision, and then reluctant to have a surgery done because of cosmetic purpose. And what happened in next 3 months, he started to complain of dysphagia. That means he was unable to move the tongue and eat something, and then landed up in 4 to 5 months in a death. So these are some cases. What would happen? Why I have put another female of 58 years is like, oh, this is just in, the other side of that. Again, CA breast post operative, who had taken a right decision in the breast lump. Okay, she got operated in 2005, got chemotherapy, but see, after 2005, it again reoccurred in 2017. Small node in axillary node, and 6 months later, swelling in arm. There was fracture of left humerus bone. Okay, that's all metastasis or recurrence what we can see. See, if that first lady who had took the surgery as the primary priority, then she would have survived, but not so. But this lady taking surgery and chemotherapy survived a later period, and but the time she approached us, that is after 6 months, like in 2017, who had a small nodule. Okay, she came to us in almost what we can call 2018 end, like 19 first. By that time, the cancer had spread to lungs. The humerus shaft was broken down. Okay, but this lady, we gave her good results. Like the pain came down. Her hand was at the time when she came to us, her hand was unable to move. Left hand. We are with the medications. She started slowly to fist. Her fist was unable to be made, but she started to fist it completely. Okay, these are meds. We did it, but this is how the things happen. But we should be known to this disease, which is so grave. Time or doesn't spare the patient needs the doctor. This is a disease. What happens, but what does India face that you should know? See, in the recent, we are getting so many news that cancer increases. There is a special train that runs in the Punjab to the train. You can understand what is a great scene. A decade, years ahead, that the cancer has a means and Gujarat most diagnosed as okay. So 2020 that India, and it could rise to in coming years, only next 2. And because most of the disturbance. Hello, hello, Dr. Anita.
Yes, sir.
Hello,
Hello, sir. Sir,
audible,
your
na?
voice is sir.
Yeah, now audible or not?
Yes, sir, it's audible, sir. Now it's audible.
Audible, na? Okay, fine.
It's audible,
Okay.
sir.
So what happens in India? What India is facing is basically the India is facing too much of problems or with related to cancer diseases because this cancer is seen at what we call as at a point when the patient passes these treatment options. That means in India there is no screening done. I mean, screening means every like in Western countries there is screening going on every year for seeing the breast cancer. If there is any lump, then immediately that lady is taken up to the investigations, and then she goes for operations and all. If there's any cervical bleeding and all, the cervical discharge is there, that lady is taken up immediately for a screening and then operated. But in India, there is a myth or a stigma that, especially those related to the reproductive systems and all, I mean, the stigma or taboo, whatever it is there, the females usually doesn't open up with these complaints as early as possible. So what would happen? The cancer which could have been averted and eliminated at a point for the first sign, like discharge in cervix may be there, or lump in a breast may be there, or a oral lesion in case of tobacco chews, it may be there, or a pain abdomen or altered bowel in case of colon cancer. These are not addressed to the doctor as early as possible. So the India is facing that the cases reported to the doctor are at almost the end stage, like cancer comes in stages like 1, 2, 3, 4. So they are almost reported at a stage like 3 or 4 where the treatment options dry up. Hardly the surgery goes off, and the remaining is the chemotherapy or palliative chemo or radiation. So this is one what India is facing because lack of screening or lack of awareness of cancer and its gravity. And above all, it is seen that the cancer nowadays is incidence is seen or prevalent in productive ages. Like cancer is seen more in age between 30 to 40 or 50. Like non-Hodgkin's, it may be there, blood cancer, it may be there, or colon cancer. So the main productive ages, like where one builds up the career, or because of this career, the nation's entire boost will be there. So this is at stake. I mean, most of the productive age between 30 to 50 years, these are the populations which are suffering. So that is why India is facing this problem very seriously, so you should know it. Then we'll see what exactly does cancer mean. So it's a very simple definition that's been given. Cancer is characterized by rapid, that means very fast and uncontrolled formation of abnormal cells, which may mass together to form a growth or tumor proliferate throughout the body, initiating abnormal growth at other sites. So what happens usually, you might have seen a simple example that I would like to give is like, the people who usually work hard, like, coolie and all, you might have seen that even if you work for a longer duration, at your hand, like, at the base of your fingers, if you work hard, the skin becomes keratinized. Okay, otherwise if you're wearing some shoes and all, at the side of the lateral malleolus, sometimes if the daily irritation is there of the shoe or something, then that part of the area becomes a little bit hard, you might have noticed. Okay, that's a change that body adapts to what the changes that are happening. That means always if the new cell is irritated, okay, the cell tries to adapt itself. Once the cell tries to adapt itself, then the functions are altered, obviously, correct? So once the functions are altered, what would happen? The cell might not survive for a longer duration because it is not a normal cell and normal functions. So again, the cell would die. So such kind of irritation, these irritations could be because of different reasons. Okay, what are those reasons then? Those reasons could be like, ionizing radiations, like x-rays are there, UV light is there in case of people who are getting exposed daily. Then chemicals, this is one of the most important part that we are facing today. Chemicals, from morning, from the toothbrush which we use or the paste which we use till the night what we sleep by on a mosquito repellent. So our entire day runs with these chemicals in an what you can bonded fashion. The food we eat has a chemicals like, different uh, what you can call coloring agents like metallin yellow, it may be there, tartrazine, it may be there, or what you can call additives like MSG, it may be there. Okay, different chemicals that are being used in the food. The oil which we eat is not that much good. They are all trans fatty acids what we eat. These trans fatty acid leads to something called as oxidative stress. You might have come across the word something called as uh, free radicals. Okay, oxidative stress, this is a very what you call trending words nowadays. So these things, put on daily irritation to cells. Okay, so daily irritations to cell, what would happen? A cell which should have survived for 3 to 4 days, like for example, if RBC is 120 days or neutrophil maybe 78 days, or any other cells of the body which have a normal life, that life is shortened. So what would happen? The cell turnover rate would be more. And if irritation is continuously to a certain cell or a tissue, what happens? The turnover rate of cell will increase. So this turnover of cell is nothing called as rapid and uncontrolled formation of abnormal cells. Got an idea? So rapid and what we can call uncontrolled. So this is important, uncontrolled. That means these cells, because of daily chemicals or oxidative stress, the formation or a turnover of cell increases in uncontrolled manner. And if this uncontrolled manner of cell is continuous, like there is, body has its own immune system which checks the growth of them, but even this immune system collapses because of the food what we eat, the chemicals that we enter, the mental stress that we go, the lifestyle, daily sleeping beyond 10 o'clock. Okay, and then having the fast foods, junk foods, these aerated drinks, carbonated drinks, and all these things are adding daily to this irritation and stress. So what happens? The cell comes to a position or an understanding that I have to multiply cells on everyday basis because my other partners are dying. So this message will translate into a rule that I will multiply every day, and this multiplication is called nothing but as cancer. And what is the next part of the definition? This tumor proliferate. Why it proliferates? Now what is the important thing is that these cells which have been adaptive means they are uncontrolled, so it knows only to multiply but not to stop when. So these cells have forgot when to stop to multiply. So this cells, if at all they reach into the blood, here you can see into the second image, if they reach into the blood vessels or if they go into the lymph glands, of course the lymph gland will take care of those by killing it if your immune is strong. But in case it is compromised, and if the blood is able to circulate these cells and throw wherever they want, they go settle at in another tissues, and in that another tissue they start growing again. It's just like how the seeds of are they fly off and then they settle somewhere and then the tree again grows. The same phenomena through the blood and the lymph vessels happen, and they start growing in different parts of the body. That is when the cancer becomes more dangerous and doesn't allow a person to survive for a longer duration. Okay, this is stuck. Okay, so next is viral infection. So sometimes what happens, the different viral infections that come. Okay, so these viral infections like papillomavirus, it could be there for cervical cancer, or H. pylori, maybe for stomach cancer. There are different viruses that is, again, these viruses are causing this erosion of the layer, the initial layer, and irritating the cells, and that again leads to the same phenomena. These like substrate being again the chronic inflammation. Okay, and hereditary predisposition. Most of the families, it runs in families. They say, of course, this runs in families because they do share a common lifestyle. That's why. Otherwise, every other person, if you take a blood from me or from you or anyone, there are circulating cancer cells in our body, but which do not develop as a cancer as a whole. Why? Because the lifestyles are different. This predisposition means there is some hereditary that people are susceptible to cancers, but if lifestyle is again contributing to it, yes, definitely they end up in having a cancer, especially the breast cancers, it could be there, or the cervical cancers, it could be there in female. Okay, they do land up in having the predisposition. Then if these are the reasons, then what are the signs and symptoms of the cancer? So there are 7 warning signs usually they say. These are for different cancers also, but it could be in all other cancers also. So they say that the first one is a change in bowel or bladder habits, especially in case of colon cancer, rectal cancer, or colorectal cancers or abdominal cancers. What happens? Sometimes there is the lump or the pathology causing damage or irritation to the intestines. They cause a change in bowel habits and bladder habits, urine, especially in case of urinary bladder. If the cancer is in urinary bladder, then the urination, there will be frequent urination, urgency will be there, the bladder will not contract correctly because the lesion is obstructing the muscles of the bladder. So these are some changes. Then second is a sore throat that does not heal, especially in case of a oral cancer, or the people who have tobacco, this and all. So they may have a sore that does not heal. Okay, especially on the skin also it could be there, or in the oral cancers that ulcer do not heal. If the non-healing ulcer and non-painful especially, then one has to check it that it could land in having a head and neck cancer, like buccal cancer, it may be there, or buccal mucosa or something, that kind. Then unusual bleeding or discharge from any opening of the body. Like, it could be the cervical, I mean, especially the vaginal bleeding, per vagina, white discharge of bleeding, and rectal bleeding. In case of rectal cancer, the pain might not be there, but tenesmus, that means if there is a cancer in a rectum, then tenesmus, that means sensation, because it is there in a rectal region, or the what you can call end region. It is like, the tumor fills the bladder, rectum, and there is a sensation to urge to defecate, but there is no stool. That tumor itself is causing that sensation. So that's what tenesmus like, and bleed once you stress. So that would happen. And then any other parts of the body. Sometimes in blood cancers where the platelets count come to, then bleeding may start. So there, but it is always associated with fever and cough. Okay, unexplained weight loss and loss of weight, especially in case of duodenal cancers, where the food doesn't go, because duodenum is very thin, small pipe, a stretchable one, because the tumor starts blocking this lumen, and then the patients of duodenal cancers slowly starts reducing the food quantum or food quantity, and then they land up in having a weight loss, and then this unexplained weight loss will lead to diagnosis of cancer. Even in case of liver or gallbladder cancer also, it could be possible. Then difficulty in swallowing or chronic ingestion, again the same, gastrointestinal, like, colon cancer, upper duodenal or jejunal, or stomach cancer, or esophageal cancer. So this would happen again. Then an obvious change in what hormone, especially in case of skin cancers and all, this could happen. Okay, change in color or a what in a mood. The last one is nagging cough or persistent hoarseness of voice, especially the larynx cancer it may be there, or lung cancer, or cough, consistent cough and hoarseness of voice. Even in case of blood cancer, sometimes continuous infections will lead to laryngitis, pharyngitis, because the count is very high. Neutrophil blasts, I mean, immature cells will be more in the blood, which are unable to fight the infection. Though the count may be high, but these are immature, so they cannot fight the infection, and hence continuous infection, fever will be there. So these are some signs which warn the signs of cancer. So you should be aware of them. Okay. Then, is there any how they are diagnosed? So if you see, go to the investigations and all, there are a number of investigations that are done. Like, for example, in case of Hodgkin's lymphoma, that is related to the blood cancer, if it is there, then examination of lymph nodes always, because lymph nodes are your, what you can call, check posts of the body, like toll naka. Okay, they will always try to catch the unwanted things, unhealthy materials from the body, pick it up, take to the nearest lymph node, and then try to eliminate it with the help of immunoglobulins and all. So it tries to kill them, try to eliminate them through one or the other way. But if at all it doesn't happen, what happens? The lymph node starts enlarging, because there's a fight between this lymph nodes and the abnormal cells and all, to eliminate them. That will lead to inflammation. That inflammation will lead to the enlargement of lymph nodes, especially in case of what you can call head and neck cancers. You can see the lymph nodes at submental region, at behind the ears, or there are different levels, level 1, 2, 3, 4, 5, 6, 7, up till. So those levels, okay, behind sternocleidomastoid muscle, anterior to sternocleidomastoid muscle, up above the cervical, clavicle region. So all here the lymph node should be examined. Okay, then complete blood picture. That means CBC should be done. What is HB? How much is the WBC count? What is the platelet count? What is neutrophil count? What is lymphoblast count? What is ESR? All these are very much important, especially in case of blood cancers and all. What happens? There may be low HB and platelets may be less, and neutrophil count or WBC count may go up to, beyond 37,000, 40,000. But they're immature cells. Okay, they're not helpful. And the other way around, sometimes the count of the neutrophil, the WBC count may go down. So all these things can be known with the help of blood picture. Okay, then tissue biopsy, which is major one. Okay, that is FNAC we call, or tissue biopsy we call, HPR histopathology reports, where the piece of a chunk of a tissue where the growth is there. If it is there in the stomach, with the help of endoscopy, the tissue is taken. If it is there in the mouth, punch biopsy is taken. If it is there in the rectum, through the colonoscopy it is done. Okay, through different method. If it is there in the lung, then bronchoscopy is used. So wherever possible, the tissue is tried to be taken out. If it is there in the liver and all, with the help of USG guided FNAC is done. So the tissue where you feel that with the help of CT scan and all, we come to know where the tissue tumor is there. So there, up till there, we reach and take the biopsy. And once the cells are examined, the just show abnormal pattern. Okay, that is what I told initially. The cells change their morphology. Once the morphology changes, function changes. Correct. So that's how. When you're in angry mode, there's a different work style. When you're in happy mode, there's a different work style. So that way, if the cell has changed the morphology, it has entirely different presentation. So based on this, we can tell that whether it is a cancer cell or a non-cancerous cell. Okay. Then mammogram. This is a non-invasive technique which is done. Mammogram in case of breast cancers. So like same USG it is done. In the mammogram, we come to know what is the tumor, what is the size of a tumor, where it is, like whether it is in anterior, superior medial part or superior lateral part or inferior lateral part, at what clock, 9 o'clock, 12 o'clock, the position is taken. And then with the help of mammograph, we'll come to know what is the position, like the tumor is only infiltrated with the tissue, or whether there is some vessels, blood vessels also running. Vascularization is seen in the tumor. If vascularization is seen, then there is something called as Baird's score, BRAIDS. So this score will tell, if the 1 or 2 score is there, then we can wait and watch. But if the score goes beyond 4 or 5, then it is definitely that it is going to lead into malignancy or tumor, so it has to be removed. So with the help of mammograph, we can identify take a decision what should be done. Then pap smear test, especially in case of cervical cancer, that is cervix, CA cervix, the vagina, the smear is taken, and then we come to know what is the whether the cells are normal or abnormal, and then cancer is there or not. Okay. Then tumor marker tests. There are certain tumor cells, okay, not tumor cells, but these cells which are abnormal in nature, I told you, they will be exudating certain chemicals into the body. Like how you do for a liver, if you find that there is jaundice, then you will go and do total bilirubin, right? Direct bilirubin, HOT, SGPT. Similarly, these tumor cells, if they are proliferating more, they also exude different kind of chemicals. So that is why there are certain tumor markers called as CEA, CEA antigen, chorionic embryonic antigen. Then there is CA 19.9 marker, especially in case of pancreas. Okay, then CA 125, especially in case of ovary cancers, could be there. Different markers are there. Based on these markers, we can tell that there is increase, like prostate PSA antigen is there. If that is there, then we can identify there's a prostate cancer. So these should be done. Okay. Then bone scan, especially in case of metastasis, especially the brain cancer, sorry, breast cancer and prostate cancer, they can metastasize to the bones. So if at all it is metastasized into the bone, then scintigraphy it is there. It will tell that yes, it has metastasized, that is spread to the bones, and we can do that. Then MRI. MRI done is usually in case of soft tissues, like if it is there in the muscles or tissues and all, no, especially. Then it is done in case of oral cancers, cheek cancers, tongue cancers, cervical cancers, where the tissues are very soft. There, the MRI scan is very important. Other than these soft tissues, if you are doubting somewhere in the abdomen, like liver and all, then CT scan, such kind of hard tissues, especially the CT scan would be more helpful. But if it is soft tissues, then you have to go for the MRI and all. Okay. Then PET CT. This is another CT scan method where there is a dye. There is a radioactive dye that is put into your blood, which is having some glucose in it. What is the phenomena of the PET CT scan is that because the dye which we give comes in a glucose form, these cancer cells which are multiplying more, I told you initially, right? They are multiplying rapidly. What does that mean? Word rapidly. That they are multiplying rapidly, that they are multiplying in a very fast rate. If these cell need to multiply, na, they need energy. So energy comes from glucose and your ATP ADP conversion, right? So this glucose. So based on this phenomena, the PET CT was made. So the glucose dye will be given, where if the cells are more active, more rapidly proliferating, this dye will be given. Where if the cells are more active, more rapidly proliferating, this dye runs to that part of the body. And so once after giving this dye, if you take a CT scan images, then that dye will go to the cancerous cells more. Other than cancerous cell, it runs into heart, brain, where more amount of blood is gushing. But still, other than these three organs, if it is rushing somewhere, then that is definitely a cancer. So based on this, we can identify where the tumor. Okay, TIS means abnormal cells but not spread. It is in situ. TIS means in situ. Okay. So that is how it happens. So again, they give different meaning to it. In situ. Okay. So that is how it happens. So again, they give different meaning to it. T1 means there's the tumor which is in early stage of a size less than 1 to 2 centimeters depending on the up till T4. That means T4 means it's advanced and 5 centimeters is called as T4 if it is in situ. So T1 to T4, this is the how they do it. For T, this is for the tumor size. Okay, tumor size and the tumor site and size. So this is important. Tumor site and size, that is T. Okay, then comes nodes. So what does nodes means? If the cancer is spread from one part to the another part, like example I told, breast cancer is there, so the nodes that will be affected in breast cancers are axillary lymph nodes. So if it is right breast, then right axillary nodes. If at all the right axillary nodes are shown in case of CT scan, then how much one node, two node, three node, how much big is the node, that all will tell that it is node. So again here it comes like, N0 means there are no nodes, number of nodes, like more than 5 to 10 nodes are there, then we can call it as N3. Then NX, cancer stage not clear, that means sometimes we know not come because nodes are not showing cells but they are enlarged. This is the conditions. So nodes. Then M means metastasis, it means spread. So M0 means it is not spread. For example, if breast cancer is there, it can go to lung, it can go to brain, it can go to bone. So M0 means it is there only in the breast and gone to axillary nodes. Like N2 is there, it's not spread to other organs, but there are lymph nodes in the axillary glands. And T2 means the node that the cancer is somewhere up between 2 to 3 centimeters. So this is how staging. So T2, N2, M0 means stage 3 that will they do. And if at all it comes to M0 or brain or bone, then it is called as M1 or M2. That means it has spread to different organs. Then definitely it is called as what we call okay, stage 4. Okay, then there are other types of cancers. So after knowing the spread, you have to understand types of tumor. There are something called as benign tumors and malignant tumors. So benign tumors means they are very slow growing, capsulated. That means they are in one small bag. They will not spread. Okay, they are non-invasive. That means they will not spread or not metastasize, and well differentiated. The cells are very identified. Like fibroadenoma was there. So fibroma. These are all called as benign cancers. Only problem with these cancers of benign tumors is that they may press on other part of the organs or a part of the body or nerve or blood vessels and cause problem, but they're not causing problem to the whole body. But malignant tumors, especially the carcinoma of CA, tongue may be there, breast may be there, these are fast growing cells. They're non-capsulated, that means there is no cover to them. They're just spreading, like how placenta is one nicely covered, covering a baby. So that's it is like in benign, it will be covering will be there. Okay, but in case of malignant, there is no cover. They just, these cells are growing like just like cauliflower, and they can break, one or two cell can escape and go into blood and then infiltrate, invade and go to other organs. These are usually poorly differentiated. The cells cannot be demarcated like this. That is what is called. Okay, then there is soft tissue heart tissues, or like carcinomas, sarcomas, lymphomas and leukemias. Then you have to understand what are the treatments available. So it's a treatment is highly variable depending on the stage and type of cancer. So commonly the surgery, radiation, that is ionic radiations are given, especially the CT scan, x-rays are thrown, or ionic cobalt they are used. Okay, chemotherapy, there are different drugs. These chemotherapies drugs are made with the help of platinum drugs or different chemicals, so that they will damage the DNA of a cell, and then the multiplication of cell is stopped. Okay, then there is something called as targeted or biological therapies. Means for example, I told you all the cells are producing certain proteins, right? If these proteins are required for the cells to be taken up and again multiply, so the proteins which are required by the cells to multiply, these proteins are blocked with the help of medicines. Okay, that's called as biological therapies. Okay, then hematopoietic stem cell transplant. That means, especially in case of blood cancers, the bone marrow is completely what you can call changed. So bone marrow transplantation is done, especially in case of blood cancers, leukemia, and also that is there. Then angiogenesis inhibitors. Always, if the blood tumor has to grow, number of cells are rapidly growing. So for those cells, blood is also required, right? So for blood is required means new vessels are getting formed. So that's called angiogenesis. Formation of new blood vessels in the tumor is called as angiogenesis. Of course, the angiogenesis itself is formation of new cells. So if at all you stop the inhibitor, angiogenesis inhibitor means the chemicals that are required for the formation of new blood vessels. So those chemicals are given so that the tumor will not receive the new blood through the blood vessels, and that will cause the slowing of the, or the growth of the tumors. That's called as angiogenesis inhibitors. These are available. Then photodynamic therapy. Nowadays, proton, light, so different therapies are evolving. Photodynamic therapies, proton is being used, electrons are being used. So these, what you can call non-ionic kind. So they are also being used as a treatment. See, this much staging is there, this much treatment is there, so nice surgeries are available, everything is available. Then if this is a case, then why we need Ayurveda, right? That's definitely a question, because so much good amount of treatment is available, targeted therapy to hit the directly the target. Why we need treatment then yet? Why Ayurveda is required? Do you think do we have a role? Okay, these are all the things that are told by good, I mean the people who are there into cancer as a modern people, not by Ayurvedic people. Okay, they say that what they say is that it is seen that around 80% of patients with various cancer report to healthcare providers in advanced stage when the disease had become incurable. See, they tell that in India, there are 80% of patients who come to the healthcare or a hospital when it is an advanced stage. That means it has spread to different organs when there is no treatment available. One. Okay. The second reason being role of cytotoxic therapy in such advanced stages. Even if at advanced stage, then what is the role of chemotherapy, the medicines which will kill the DNA and stop the formation of a new cells? What is the role? Because these chemotherapies, they will not only kill the normal cells, they are going to kill all the fast dividing cells in the body, because the cancer cells are fastly dividing, so it kills them. But what are the other parts of the body where cells are fastly dividing? With the same rate your intestinal mucosa divides, at the same rate your oral mucosa divides, with the same rate your hair follicles divide, with the same rate your bone marrow divides. That rapidly your intestinal cells, bone marrow cells, hair cells, okay, then oral mucosal cells, different cells of the body also multiply with the same speed. So again, these chemotherapy drugs will also kill these cells. So imagine your intestinal mucosa being damaged, imagine your hair follicles being damaged. That is why the hair fall in cancer patient. That is why the blood immunity comes in down in case of cancer patient after receiving the treatment, because these are cytotoxic drugs. Cyto means cell, toxic means poison. So these poison materials are killing the cells, not only cancer cell but even a normal cells. That is why. And then another doctor says that India needs more holistic approach and strategy in cancer management. That means there is the requirement of another branch of medicine which will also take care of the body. That's why Ayurveda is needed. Okay, the view of the integrated oncology. Again, the modern people say that, gives a statement that ethnic medicines, that means we alternative medicines, they believe, but though it is the Indian, what you can call origin medicine, though they call it as alternative, but it happens to be the most foremost medicine of India. So these ethnic medicine may not parallel to the conventional treatment. They believe they are just conventional. So they believe that though it will not be equivalent to the chemotherapy, radiation therapies, alternative therapy, but have a substantial role in palliative management of cancer. Palliative management means at least the quality of life. Quality of life means these patients who are unable to eat, unable to walk, unable to talk normally, they go into depression. So most of things will happen. But in Ayurveda, because of holistic approach, what will happen? Our drugs will act first on rasadhatu, mana, right? If mana is good, then what happens? Vishado roga vardhanam sreshta. Charaka tells that if Vishada, that means depression will increase the disease very fastly. But our medications will act on mana. They will improve the rasadhatu, which does the prenana of mana, helps to remove the patient from this depression. So that's why palliative care or quality of life can be improved from Ayurveda. And what we can do, what is the importance of Ayurveda? Because we are from doctors to dietitians. We know what is Patya, we know what is Ganji, we know what is Takra, we know what is Shadangapanya. So we know that, but modern people, they only prescribe drugs. So from doctors to being dietitians, we know. From diagnosis to death, we know, because we know what is death, Atman and all, we have that. And from hope to cope, that means we know that there is asadhya. They have told very nice asadhya lakshanas are there, arishta lakshanas are there. Once you know all these things, now you can, from patient is hoping that he will survive, but you have to tell the patient that you have to cope up with the death. So we can, from hope to cope, we can establish. From relief to rehabilitation, sometimes post operatively there will be strictures, most of the things they go into depressions, right? So from relief, providing some relief to the symptoms, to rehabilitation, we can help them to overcome this. So that's why Ayurveda is needed. Okay, where else it can be? Okay, we'll see later. Whether that there is some cancer told in Ayurveda. Yes, though according to the modern science, the understanding of cancer is still evolving. That means they are trying to understand what exactly the cancer cells are, how they are. Okay, okay. So they are able to understand it. Now, what is the understanding in Ayurveda then? In Ayurveda, there are different explanations that are given. They come under different umbrella. Okay. Like they are explained in the name of Arbuda, they are explained in the name of Granthi, in the name of Apachi, in the name of Gulma, in the name of Galaganda, Galauga, Gandamala. I have highlighted these five. Okay, but there are other things called as Yakshma, Rakta, Pitta, Visarpa, especially the Rakta Pitta in case of blood cancers. What happens? Usually we say that Rakta Pitta blood cancer patients usually they come with the complaints of fever, uncontrolled fever, cough and all. So even in Ayurveda they tell that if jwara is not treated correctly, it will land up in Rakta Pitta and cause Urdhva and Adogata Rakta Srava. So same, like if Pitta guna of the Dravaguna of Pitta is not controlled in the Jwara, or Jwara is not being controlled, the Sushna and Dravaguna will lead to what you can call takes off the Sleshma, and then slowly starts leading to Rakta Srava from Urdhva Radhogati. So Rakta Pitta is one condition where we can understand as a cancer. Yakshma, because continuously the patient is unable to eat something, because there is avarna, continuously there is tumor proliferation going at one end. Okay, there is formation of Arbuda that will lead to Agdimandya, and then Dhatukshaya, Avarna. So there are different pathophysiologies which will come across Kaya Chikitsa in the next year. So you'll understand why Yakshma I was telling. Okay, Arbuda, Granthi, Apachi, Gulma, Ganda, Galoga, these will all be explained for you all in the Shalya Shalakya. And what does they tell? They tell Saptadhatu and Tridosha. So see, here they tell that there is no disease that is devoid of dosha, they tell, right? Dosha dhatu samurchana will lead to disease. Right? No, but why they told different arbuda, granthi, apachi, gulma and all? Because they will lead to these diseases. Okay, there is arbuda, and Medha Dushti, and when it involves Mamsa and Rakta also. Though the Granthi also has same Kapha, Medha, Mamsa, Rakta. Okay, but the Granthi will get Paka, but Arbuda will not get Paka. We'll see in successive slides. Okay, and Arbuda is Apaka because it is predominantly having Kapha and Medha in it, rather than though the what you can call pathophysiology or Samprapti starts in all Mamsa and Rakta, because the Rakta Dushti itself formation of these diseases. You might have seen there is a shloka. I'll just if you see the Rakta Dushti, what Prakopa Lakshana or the Rakta Dushti Nidanas, all the modern things what we see like fast food, junk food, okay, they pour the ice cream, what they call, their sizzlers, what we call, such things may be there. All the chemicals that are we eating, Ushna, Tikshna, Vyavai Dravyas, all these food materials are causing Rakta Dushti, and Rakta Dushti is doing Poshana to the Mamsa, right? Rakta is doing Poshana to the Mamsa next to Uttara Uttara Dhatu. So once this Mamsa and Rakta gets vitiated, then obviously the next Uttara Uttara Dhatu and then Kapha, that is Rasa Dhatu itself gets weak with the Rasa Apu Sleshmavat, right? So all these dhatus will one by one will lead to, if it does the Pidana of Mamsa, then they'll end up in having the Granthi, Arbuda, Apachi. Okay, Gulma being an entirely differently, it's an abdomen which is Vata predominant, though Dhatu will come hardly into it. So Vata Pradhana Gulma, where Vata is predominant, but other doshas are also important. So these are certain diseases which are told in Ayurveda. Okay. So you can see here, they have told in Ayurveda that is dosha samuchita mamsabi pradushya vratam stiram mandarujam mahantam alpamulam chirad susceptibility. So mamsa pradushana can takes place, and if it takes place, vruta stira, enlarged stira, mandaruja, mild pain maybe there, maha ananta moolam, deep seated. Okay, I cannot completely translate these words because of the time. If you go to the right? So, but these are some references which are told in Charaka and Sushruta. So, Chirat Vruddhya, that means it takes longer time to that is what happens in and then one day it other Paka. You know, they all get Paka, may go it will lead in that way, right? That's called Paka, Kota, it will go. But it means it starts growing, but it will Puya from it. Then Kumamsa, you know, treated in or Shastra, these are treatment modalities that can be there. So these are again same. So you have to this is Dalaganda Adhikarana, again same. But Ghata Pradesh, Dosha, Mamsa Asra, can you see her? So Rakta and Mamsa Kurvanti, Mamcha, Ghadam, Arbudam, Shastra Vido Vadanti. There are different types again, like Beda Vastavate, Pittena, Kapena, Chapi Raktena, Mamsena, Samena Sava, Jay. So there are different, again, this is the super speciality kind of understanding. Like, you know, there is maybe Gulma, there may be Arbuda, there may be Granthi, but some people will tell I'm having pain more, some people will tell I'm having burning sensation, some people will tell I'm having heaviness, some people will tell I'm having tingling sensation. So these what you can call characteristic presentations, that having numbness, having burning sensation, having heaviness, this is the super speciality presentations what I believe, because though there is gulma or though there is granthi, though there is arbuda, but basically because of this one or two factors we call it as vatena pittena kapha, and based on this the drugs will change a lot. But in modern people, if it is arbuda, then only chemotherapy, but there is nothing, right? So with help of these understandings like vata pitta kapha lakshanas, we are so super special that we can select the drug based on this tingling sensation, based on heaviness, based on burning sensation. That is the speciality or Pratipurusha Siddhanta, or what we can call that kind of understanding. This is Arbuda. Like, you know, na pakamayanti kafa adhikatvat, meda bahutvaschcha visheshastu, dosha stiratvat grantana cha tesham sarva arbudayaneva nisargastu. That he tells why it is apaka is because they tell here कफमेधसो अधिकमिति विशेषतः ततो न pakam ayantihi, that is nisarga only, because it is having kapha pitta adhikatah, that is why it doesn't go into paka. If at all it includes rakta into it, then it goes into paka, because pitta comes, pitta and rakta ashraya bhava. So once pitta adhikata or rakta adhikata starts, then it goes into paka, where it happens in granthi and all. Okay, but if it is kapha medha, then it will not go, because kapha is sthira. Okay, that's why it doesn't go into Pakavastha. This shlok is there, so you can get it from Sushruta. Okay, 48th chapter, Sutrasthana. Then, what are the other two reasons why Ayurveda should be understood here is because in Charaka, Chikitsa 30, like after the telling Yoni Vapas and all, he tells this is common to all. What he tells, Nivrutto api punarvyadihi swalpena ayanti hetuna kshine margi krate dehe shesha sukshmeva anila tasmat anubandhaniyat prayogena anapayinam siddhartam prak prayuktascha siddhasya apyaushadastu. And he tells Nivrutte api punarvyadihi, that though we feel the disease might have gone, but salpena ayanti hetunam, even if there is a small little factor that is remaining, kshine margi krate dehe, because of Vyadi already the Kshina Sharira may be there, or Marga are not that good. Dehe Shesha Sukshmayam Anila. Little bit of amount of Anila, like how there is little bit amount of fire left. Only by blowing to again adding little bit amount of husk and blowing it up, it will catch fire again. Similarly, a little Nidana or Hetu for this Vyadita Sharira is more than enough to bring back the disease correctly. So Tasmat Anubandhaniyat. So followingly to the diseases, Prayogena Anapayinam, those that are not causing much damage to the body. Siddhartam prak prayuktasya siddhasya apaushidinam. Siddha means like rasayanas and all should be used after treating any diseases he tells. That is why Ayurveda is important, because they know that it can come back. Okay, what is the other reason? They tell that tesham prakopata stanascha eva marga शरीर धातवः प्रकोपम् आपद्यन्ते इतरेषां प्रकोपादितराणि च इतरेषां प्रकोपादि इति इतराणि च that means स्रोतांसि स्रोतस्यैव धातवश्च धातूनेव प्रदूषयन्ति प्रदुष्टे. That means one srotas to another srotas, it can cause disturbance. From one dhatu vikruti to another dhatu vikruti can happen. Vata pitta sleshmanah pradushta dushaitaro bhavanti. That means there is some hint that they have given for metastasis understanding in Ayurveda. That means there is understanding in Ayurveda of cancer. Okay, so this is about cancer understanding. What is cancer stages? What is told in Ayurveda and all. Okay, but the patients who come to us will come with these things. Needs to be approached directly. The patient will not come. It will receive all the modern treatments and come to us. So once it comes, how the presentation is, it has pain, weakness, loss of sleep, fatigue, wounds will be there that are because of radiation, loss of appetite, nausea will be there, vomiting, nutritional imbalance, swelling, edema, psychologically like anxiety, depression. These are all the complaints that are coming to us. So how we adopt it, then what are the treatment adopted? So therapeutics at post chemo radiation. That means these patients will come after chemotherapy and radiations. So what we do, we give them matra basti. You know, basti, I think by this time in the first year or second year, they might have told, right? So basti are given, like various grita taila are there. We usually use grita because taila is having again ushna guna, which will lead again rakta prakopa. So grita are always best. It is oja vardaka, right? And then some skarasya anuvartani. It carries its own guna. It does pitta shamana, but does agni deepana, right? So that's why gruta are always preferable. Then pichu is there for pain and all. If sleep is not nice, so we keep pichu on the head. Sleep will induce, pain will come down. Kavala gandusha, especially in case of radiations to the mouth and all, it causes severe burning sensation, pain and all. So gandusha with panchavalkala or trifla or so such things will be very helpful in understanding travel. Okay, then parisheka, then before treatment, like if the patient wants before the treatment of modern treatment, then you can give consumption of daily grita to them, because in one context of Ayurveda they tell, if at all in poison, like if you feel this chemotherapy and all, they are all poisonous because of Vyavayu Vikasi Tikshna Guna only, they cause Kshinata to the body, right? All the signs and symptoms that happen after chemotherapy na, they are equivalent to Amasha and Pakvashigata Vishalakshnas. So you can go and see once. Okay, that's a assignment what you can take off to the home. So Snehapana, Matravasti and all. So we give this Grita initially only before the treatment is be given. So that has also giving good results. So here are what I was explaining. So head pain, leech therapy, Kashaya, like GI disturbances are there, respiratory problems are there. Then we give Patalkotuvnadi or Guduchadi Kashaya in case of GI disturbance, Agni Mandya. Okay, Patalkotuvnadi is told as Niyanti, Kapha, Pitta, Kushta, Visha, Vami, Arochaka. It means Visha, Arochaka, Vami. All these conditions suit. So we give Patalkotuvnadi Kashaya, Guduchadi Kashaya in case of respiratory problems, Balaji Rakadi Kashaya, okay, or Nayopayamadi Kashaya. These are very helpful. Then in case of nausea, vomiting, loss of appetite, mouth ulcers, so we can give Madhifal Rasayan. Again, Saptachitadi Gandusha we can give, or you can given to drink inside. Okay, then Mandapeya, especially in case of loss of appetite, diarrhea, fever, fatigue. Okay, we prepare Mandapeya with help of Panchakola. Okay, Dhanya Kafanta Yukta, Laja. So the I am explaining you all whatever I have given. It is not textual. I mean, these are all from the textbooks, but whatever I have practiced and whatever I have got the result, I am explaining you those only, nothing other than that. Though we feel Panchkola, Shradangpani are very small medicines, but they work wonder in cancer patients in bringing back to normal see, especially in food, GI disturbances and all. Okay, then Yusha soup. So again, Mudga Yusha, then Khada Yusha, like pomegranate juice and all. We prepare those. Meat soup we give. Okay, these are all helpful in for bringing back the weight of the patient. Kshirapaka, one of the wonderful preparations that we can give to the patients. Ashwagandha Kshir Pak, Nayopayam Kshir Pak, Panchkola, then which is Rakta Prasadana, Shodhana and all. So those patients. Then juice of Rajuradi, patient will be having generalized cachexic condition, means the patient becomes loses weight, nausea, vomiting, fever will be there. Almost more than 20, 15 to 20% body weight loss is there. That's called cachexic condition. In those conditions, Karjuradi Manta, Chinchapanaka will help a lot for patient to bring back strength. You can see the strength will be regained within 1 day or 2. But at least a day he will feel fine or giving those gives also having nutritional benefits other than giving strength. Okay. Shadang Panya in case of fever, diarrheal conditions and all, we a lot. Basma a lot, like Hirak Basma, Suvarna Basma, Tamra Basma, Abrak Basma, Yashada, Zinc, Lohar, Rajata Basma, especially in case of blood cancers may be there. Suvarna Tamra, especially in case of liver or GI disturbances may be there. There it is very helpful. Okay. Then how we can manage, like nausea, vomiting is there. Then we can understand, like indigestion is there. Vata Kafaja, Ama Pradana Yukta. Then we can give Patal Koronadi or Madhifal Rasayana or Dasma, Tamra Basma. If at all nausea vomiting is there, but burning sensation, no indigestion but burning sensation, then that is Vata Pitta. Okay, then we have to go for Buni Badikada or Guduchadi Kashaya. Then you can use Kamduda with Mukta or Suvarna Sucheka, that is Sutendra we can use. If there is blotting and indigestion is there, then only Vata. And Arogyavardini, Shankavati, it can be given with Takra or Gomutra can be given if at all it is associated with ascites and all. Constipation, abdominal, pain, again vata. So if at all it is ruksha, then you have to go with taila. If it is with ama yukta, then you have to go ama pachana, like bhaushankavati or aragyavardhini, right? Then hingvashtak churna, dadimashtak churna, hingu triguna taila. If you feel that it is because of ruksha guna, then hingu triguna taila. If you feel because of ama, then give hingvashtak churna, that does ama pachana, and then anulomana. Okay, mouth ulcers are there, then that is pitta. So for mouth ulcers, yashti madhu, which is shita guna, rasayana, okay, shitalam, kesha. So those you can give panchavalkala, saptachadadi kavala, kamduda with mukta, or only gairika can be given for application. Loss of sleep, okay, appetite, these are all vata pitta. You can give kumari asava, you can give agnitundi vati if at all is associated with whole body pain. Then give pichu, those are there. Cough and dyspnea without expectorant with burning, then vat pitta. Then you can give nayopayam kashaya and all. If it is expectorant are there, then give Balajirakari Kashaya or Talisadi Churna, Kadiradi Churna. Then dyspnea is there, constipation is also there. Then give Abhaya Arishta or Dhanvantar Gulika. Dyspnea with cardiac issues may be there. Then Dhanvantar Gulika may be there. Or Brahat Neopayam Kashaya, Vidaryadi Kashaya, which is both told in case of Pranava Srotas. Pushkar Mulaso can be given. Okay. Then cup with pleural effusions, Vata Kapha. Then give Lagu Panchamul Kashaya, Samir Rasayana, Dashmul Katutrayadi Kashaya. So though there is cough, dyspnea and all, but one or other complaint will make difference like Vata Kapha or Vata Pitta. So this is the advantage or what you can call super specialty practice for Ayurvedic people is because these complaints will change the medications like anything. Okay. This is the myalgia, Vata is there. Then Lagu Panchamul Kashaya, like Angamarda Prashamana it is told. Okay, so there you can give. You can give, if at all Agni is good, then give only with Kshir Pak. If Ama is there, then give only Kashaya with Agni Tuddivati. Neuropathy, Kshirvala capsules or Indriya Kalyanaka Rasa is there. Or Kumar Kalyanaka Rasa, it's a modified form of that. Then loss of sleep again, Vata Pitta. I told Gandharvasta Tail or Dhanvantari Tail. Fatigue, like Srota Avroda will be there. So Vata Kapha, then give Ashtavarga Kashaya, Drakshadi Kashaya, which will improve that. Generalized weakness, Vata, Matara Basti you can give. If at all Agni is good, then abdominal pain, then Ajmodadi Vati can be given. Diarrhea, Vata Pitta, it is like, Saraguna and Lagu Suchekaras or Kaideria Dikashaya, Kutajganavati, Panchamrata Parpati. Okay, these are them. Then in case of yoga, pranayam can be for counseling. Every day you have to talk at least 10 to 15 minutes for patients. Then only it will be helpful. So this is how what we can understand. Okay. So you can see it from last 5 years. This is at our OPD what we practice. See, so you have to start practicing that. The main important is you have to believe your sciences. See, I'll give example to my students wherever I go. See, no one see, they just tell that DNA is double helix. No one has seen it, right? Only 1 or 2 persons have seen and they tell it. So you believe and we trust them. So similarly, our acharyas might have experienced Vata Pitta Kapha and they have told us. So we have to believe our fundamentals and start doing it. And that is the reason why we start. At least we, what our teachers taught us, okay, that you have to believe these doshas, dhatus, they are there. You have to see it clinically. It will be seen in your final year once you go into understanding medicines. After giving medicines, you will start understanding if that lakshana has come down, that is vata lakshana has come down. If it is burning, that is pitta come down. So try to understand in this fashion. That is the only thing which has helped me, and that is why these numbers are like from 30 to 153 or from 163 patients in 2016 to 410, 500 in 2019. Okay, these are IPD. You can see initially we used to not admit patients. Now we can admit more than 100 patients per year. Okay, see the number of cancer patients that are approaching. At before, that brown color indicates before. That means they want Ayurvedic treatment before only taking any treatment. And most of the patients come after taking the modern therapies. This is how it happens. Okay, and different what you can call, these are all international people say in, okay, integrating Ayush into palliative care, potential role of Ayurveda in integrating oncology, efficacy of complementary alternative medicine in relieving cancer pain. Okay, complementary medicine in palliative cancer care symptom. They are telling to include the complementary medicines in the syllabus of the modern people. Here it is there that modern people should also be thought about palliative care. See here they tell. Okay, palliative cancer care a decade later. Okay, that means already it is started in America. That means they have started using those. Ayurveda and plant-based intervention for cancer management system. That means things are happening. Okay. Considering the time, I'll just run through this. Okay, there's a patient of Hodgkin's lymphoma, 27-year female. Okay, she had Hodgkin's lymphoma in 2011, then took 6+6 chemo cycles. Then 2017, again she had, again took six chemo. Okay, then she had again in 18. She was unable to pain during swallowing, cannot eat anything, associated with fever, cough, generalized weakness, on and off. 15 to 20 days of initiation of treatment, pain during swallowing came down. Okay, but the patient was adamant on following medicines, complaints or waxing and waning. That means the patient feels better, then again 20-15 days she's not there. Again comes back with complaint. Okay, then we had given her Sthanik Abhyanga, Rakta Basti. We gave goat blood to her through the Basti route. Okay, here you can see this patient, 2018. Okay, last date I'll show you. She followed till 2019, till 20th. The last page is not there. One slide is missing. Okay, but she is following up to us. You can see here she started previous complaint dysphagia has come down by 80%. She was unable to eat. Now she is able to eat normally. Okay, within a month or month. So you can see here these lymph nodes were there, but after treatment they are gone. Okay, that is how Ayurveda can treat. I will not go much into patients because you won't understand, but try to understand cancer as early as possible because you are having a good future in the cancer management. Ayurvedic people. Okay. So at this point, I have to acknowledge my teachers, B.S. Prasad sir, Dr. Yogesh Bhandare sir, and Vishwavaidya Brahmadatta Nambudiri sir, because of whom I have a confidence of managing cancer patients today, as because of all these three people who have made me what I am today. And other teachers like Dr. Prabhakaran sir, Dr. S.K. Ravi sir, Mahesh sir, right? So these are the teachers who have helped me a lot in understanding. So close the care gap. I have explained you all how to close this care gap, and we will do it. Okay, thank you.
Thank you, sir. It was a very nice session. Any queries? Thank you, sir. I wish to express gratitude to our guest lecturer, Ayurvedic physician, Dr. Santosh Patil, sir, for enhancing our knowledge. Special thanks to enthusiastic delegates for their active participation. All Ayurvedic colleges across Karnataka and India for motivating their staff students to join this event, without whom the session would not be successful. It feels immense pleasure to thank founder Shri S.B. Ghadge, sir, our source of energy, chairman Mr. Amit, sir, Managing Director Dr. Mansi Ghadge ma'am for their encouragement, guidance and support. We also thank our principal Dr. S.V. Gadili Shetty sir, Organizing Secretary and Vice Principal Dr. Agadatantra sir, Event Coordinator Dr. Ashwath sir, and finally technical team Dr. Vishal Banti sir, Mr. Rishi, Sandeep and other teaching non-teaching staff of hospital and college. We thank once again all delegates to all who have raised this lecture and made it a grand success. To end, your illness does not define you, your strength and courage does it. Thank you all. Thank you, sir.
Thank you so much, Anita, and uh, the management for providing me this opportunity. Thank you once again.
So there is a query, sir.
You tell me.
Is cancer a genetic? Is cancer a genetic? I mean,
So, yeah, see, this question is very what you can call uh, questionable because see, I told you all there are genes that are known to cause cancers. Okay, they are always in a silent mode. Okay, but what makes this gene to get expressed is your lifestyle, your food, everything. There are most of the time, see, stress is also an important factor. I'll tell you all. Most of the people drink and smoke, they do not get cancer, but the people who do not drink and smoke, sometimes they have cancer. So what is the reason then? Do you feel genetic is a cause? Though there are what you can call etiologies, but some is not getting, but someone is getting. So genetic is what we call, like, they carry a ticket to have the cancer, only that much. But if your lifestyle is good, then that can be avoided.
yes. Thank you so much, sir.
Yeah,
Thank you, sir.
thank
Now
you.
we'll come to the end of the session. Thank you, one and all. Thank you, sir, for being with us.
Thank you, Dr. Anita.
Thank
Thank you once again.
you. Any session.